Hey guys, what is up? And today is Friday, so why not have a educational PowerPoint that will help you understand what this thing called shock is. I'm Denise and welcome to Life Cycle 360. If you're here for the first time, welcome. We will be doing a short tutorial today on getting more understanding of this topic because it's something that's often mistaken with, getting shock in where you put a pliers or a screwdriver into a plug and you get shock. That's not what we're talking about today. All right, so let's get to it. All right, so what is shock? Shock occurs when the body tissues and cells, they're not receiving enough oxygen-rich blood. Now, when we breathe in, we're taking in oxygen, and when we breathe out, we're releasing carbon dioxide and other gases. So we need oxygen, and our blood is what is able to transport that oxygen to our vital organs. So it's important that we have the blood to do that. We often confuse the word shock with that of the electric shock, and we are not really sure what it is. So this is why I'm doing this today, to help you get educated on this topic. Shock or hypoperfusion describes a state of collapse or failure of the cardiovascular system. Shock can also be associated from heart failure and severe allergic reaction, or what we call anaphylactic shock. Now, why we want to understand what shock is, because this is actually a life-threatening condition. It's not a disease per se, but it's a condition that can occur when things don't go according to how it should in our body, especially where our circulatory system is involved. So it's very important to understand what is shock. To me, shock refers to a state of collapse and failure of a cardiovascular system. And when you talk about that feeling, you're left with inadequate circulation. And without proper circulation, you're going to have inadequate cellular perfusion. And this is what is the life threat that happens if this condition is not corrected, or, if people are not aware of the signs and symptoms and so forth. So for this PowerPoint, I'm going to focus on the cardiovascular type of shocks that we have, right? So in order to understand shocks some more, we need to understand our circulatory system. And our circulatory system consists of three independent systems that working together. They work together. We have the heart, the lungs, and the blood vessels. And the blood vessels are going to be the arteries, the veins, and the capillaries. They all work together to provide the body with blood, nutrients, oxygen, and other gases. And they also are able to take them out of the body. I always say this body is such an amazing thing. When it's working, but when there's a problem with one out of these three things, then we see a collapse, we see life threats, and we have to react quickly to this condition, especially if it's affecting one out of these three things. Let's go on. Okay, so we're going to look at some of the causes of shock. And to make the understanding of shock easier, when we're thinking about the circulatory system, we're going to use three components. We're going to be using the pump, or making reference to the pump, which is the heart. We're going to make reference to the pipes, which is the blood vessels. And we're going to make reference to the container, or the vessel in which, I would say, the body, which the blood is able to move around. Now, all of these three things are what can have the shock to occur, especially if it's relating to the circulatory system. So there are other forms of shock, and as I mentioned before, we are going to focus this week on the cardiovascular forms. There are non-cardiovascular forms, and Those would be such as respiratory insufficiency. We have extreme allergic reactions known as anaphylaxis, as I mentioned before as well. And we also have psychogenic shock. And what that type of shock is what happens when you see somebody fainting or collapsing due to that particular type of shock. That's actually what happens when somebody faints. But we're going to focus on the cardiovascular types here. Right, so the pump failure, we would call the pump failure cardiogenic shock. And this is when the heart is not able to pump blood constantly through the body. We will have inadequate perfusion that will take place in the body's organs and the tissues. So diseases such as coronary artery disease, if you have past heart attacks or heart surgeries and so forth, those things can cause damage, because what you'll find from a damaged heart, you have the heart and the muscle in the heart having to compensate, and from there you'll have an inadequate amount of blood being able to pump out of the heart. And if that blood is not able to sufficiently provide enough towards the whole body, the shock will take place, because you're going to have not all your organs being perfused with blood, right? And the body will try to compensate, increase in heart rate, increase in blood pressure, and so forth, to get to the point where all of the organs are fulfilled with blood. But it doesn't happen, because the problem is not the ability to have enough fluid in the body. The problem is the pump is not working to push the blood throughout the body. The major problem from this, when you have cardiogenic shock, is you have a backup happening in the lungs, and that causes pulmonary edema and also all different types of congestive heart failure, mostly the left side. Now, this is a little bit more than what I would normally teach in terms of with the basic first aid, and this is intended as an educational type slide. So you may hear me using different words, but don't be too alarmed. It's just to help you understand what I'm saying, and you can make reference to what I'm saying too if you're not catching on to what I'm trying to explain, right? All right, let's go again. Right, so we just spoke about the pipe being a problem. Now we're going to talk about the container loss of blood or fluid, right? If the container is the problem, meaning that the container no longer is able to hold the amount of fluid that it has to have adequate perfusion, that container is being drawn out of the fluid. And if you're looking and referring to the body in that case, it's where the person would be losing blood and fluid, and that type of shock would be known as hypovolemic shock. The pump would be working really good, so the pump is not the problem in this one. The problem is going to be where the container is not having the amount of fluid it's supposed to have for proper perfusion. When serious traumatic injuries happen, think about a vehicle crash or an amputation. That's why it's so critical that when somebody is losing blood, they can quickly go into shock and different stages of shock, and we'll get to that in the upcoming weeks. When you're losing blood and you're not able to get that provision of, supplying the body with fluid, like what you'll use with an IV or normal saline, you have a serious problem taking place. So think about that. This is called the hypovolemic shock, and it is when the container doesn't have enough fluid to have adequate perfusion of the cells. And it can happen from both internal and external fluid loss. It's very easy to see external fluid loss if you have somebody, you have a severe laceration that is bleeding profusely. But if you have internal bleeding, you'll have to look at other signs and symptoms that you will know that person is losing blood. And we'll get to that in the upcoming weeks. You can also have thermal burns, and with thermal burns, you can see that person losing blood, because blood is not only made up of red blood cells, but you also have plasma, which is the main fluid. And the plasma, or the fluid part of the blood, it leaks out of the blood vessels into the damaged or burned tissues. So think about if you have a nice smooth blood vessel carrying blood, and for when you have a thermal burn that is damaged, you're gonna have the fluid or the plasma leaking out of the blood vessel and going into where it has been burnt or damaged. And that is also considered hypovolemic shock. Okay, so the next one we're going to look at for cardiovascular types of shock would be the pipes, if there's poor functioning of the pipes. Now, the pipes we're talking about pretty much in this would be the blood vessels. Now, blood vessels can dilate or they can constrict. Now, the main thing that we would want our blood vessels to do is constrict, not really dilate. Dilate, something else is happening to cause that dilation. But we have that flight or fight, where when epinephrine is released, let's say you're running from something, you need to get blood going fast to all parts of the tissues and the muscles to move fast or to fight. So there's a lot of constriction that takes place there. So injuries to the spinal cord can cause injury to the nervous system, and that controls the constriction of the blood vessels. So if you have damage to the spinal cord, you can no longer have constriction of the blood vessels. You'll have the dilation, and you pretty much getting really, really just flaccid and very large compared to what it normally should be. In this picture, you'll see here different images. One will be just a normal, the one to the left is going to be a normal cross section of the blood vessel. You'll have vasoconstriction and you'll have vasodilation to the end on the right side. If this happens, the blood vessels dilate and they increase in their normal size, as you can see in that image there. This increases the size and capacity of the vascular system. The ability to move blood throughout the system is now compromised, and the blood in the body can no longer fill in large vessels. That is where we have poor function of the pipes or the blood vessels. Last but not least, relating to the cardiovascular causes, is a combination of the pipe failure and fluid loss. Now, what can that be? And it's something that I think very seldom spoken about: septic shock. And it happens where severe bacterial infections in the body are being produced because you've probably had some sort of whatever, and however it reached into the body, it's now become poisonous into the blood vessels. The toxins are poisonous and they damage the vessel walls, which causes fluid to leak out of the vessel walls. When that happens, you have again widespread vessel dilation combined with loss of plasma, because it's going to leak out of the blood vessels, just as what you'll find in the thermal burns, where once you have dilation taking place, it's easy for fluid to seep out. And with widespread vessel dilation combined with loss of plasma from the damaged walls of the vessels, it's going to result in shock again. Right. So we pretty much covered all the cardiovascular type of shock, and next week we're going to be heading into the non-cardiovascular shock and how we can manage patients in shock. Now, if you do have any questions, please leave them in the comments below, and if you enjoyed this video, please share and hit the like button, and don't forget to subscribe. I'll be putting up the next part of this video next week Friday, so stay tuned for that. And as always, guys, education is life. Learn more and become more. See you guys next week. Bye.